Hello, second year dental students. Welcome to the last lecture of the dental anatomy theory course. This is Dr. Siham Al-Araj with you. This last lecture will not be dropped. It is the very last lecture that will be summarizing the whole course. I mean, literally, it will give you a gross outline for the main points in your dental anatomy course, which you have taken. This is lecture number 14, and it will be about the physiology of the permanent dentition. So to make it easy for you, I will give you a printed outline for this chapter containing these 7 topics or subjects. If you look into your textbooks, this will be chapter number 4 or chapter number 5 in your book, which comes after the introduction to dental anatomy, after the annotation systems, after the chronology and development, which you've taken in lecture number 13, sometimes it comes after the chapter of primary dentition, which you have taken in lecture number 12, and it is the chapter preceding the description of the permanent teeth. We will be, as a lecture outline, talking about firstly form and function, then size of crown and root, interproximal spaces, proximal contacts, embrasures, or what's called spillways, cervical line curvature and occlusal curvatures will be given very fastly in order to understand the form of function of the teeth. All these aspects should be considered. So the phrase form and function, it is used to describe an evolutionary process of the morphological features. For example, teeth as a part of the body have a morphological feature and activities, which is the form of this tooth is fitted to the activity or the function of the whole system. So related to the teeth, we explain the interrelation of the shape of the tooth and its function. And when we say a function, it is applied to the entire masticatory system as a highly coordinated functional unit. So the components of the masticatory system is closely related to the individual function of each of the components and to the functions of the whole system. What are the functions of the orofacial system? It is mastication, deglutition, which is the swallowing, the phonetics, responsible for the sound, the aesthetics, the facial appearance, and the maintenance of the supporting tissues. The primary function of the whole complex and system is to prepare food for swallowing and to facilitate the digestion. Different types of teeth have respective forms and they are adapted to incise, to shear as in premolars, and to grind as in molars. Now you know, after taking the course, that we have adaptive forms of the incisors, of the premolars and of the molars, which define its function. And Then the teeth with their alignment also, a proper alignment of the teeth would protect the supporting periodontal tissues against any trauma during mastication. It will facilitate the jaw movement, it will facilitate the speech, and it will enhance the aesthetic appearance of the face. When we say a orofacial complex, not only the teeth are included, we include also the lips, cheeks, the tongue, and all the forces of the masticatory muscles, the PDL, periodontal ligament around the teeth, contributing to the elasticity, absorption forces. Firstly, talking about the size of crown and root, they should be in a tooth proportional to each other, and they should be proportional to the jaw size. That's why there are individual differences between people and between single teeth in the same individual. Size and shape of the root, they would reflect the function of their respective teeth. For example, a canine have the longest roots, which makes them extra anchorage and extra size, supporting the canine and its location at the corners of the mouth. So the canine can withstand the bear the shear forces. Second example are the molars, maxillary and mandibular molars. They perform most part of the grinding of food, so they require multiple roots to withstand high masticatory forces. Especially maxillary molars have trifurcated roots. Affurcation, it means they are diverse. The roots are separated in a trifurcation, in a tripod arrangement in the alveolar bone, providing them with excellent anchorage. In addition, we have many developmental depressions on the roots, lateral surfaces of the roots, also to increase the surface area and enhance anchorage in the alveolar bone. Hence, you can notice the canine teeth with longest roots to withstand the shear forces at the corners of the mouth, and also the tripod arrangement of the maxillary molar roots to provide anchorage in the alveolar, maximum anchorage in the alveolar bone. Secondly, the teeth form have also a function not only in the digestion of food, incising and occlusal forms of the teeth. It also have a interrelation or direct influence on the jaw movements. So how is that? Looking into multiple aspects of the teeth form, for example, the conical shape cusps, which happen in the humans and the canines, which have prominent conical shape canines, that would limit any lateral movement. Also, we have what we call prognathic jaws, which means the mandible and the maxilla bone, jaws of the bone are overlapping each other. They are not equi-sized. They are not in the same size. We have a maxillary jaw that overlaps the mandibular from the labial and buccal sides, or facially, let's say, in the horizontal plane in what is called prognathic jaws. Thirdly, We have the high complexity of the occlusal anatomy of the teeth, which is directly related to the high complexity of and specialization of the temporomandibular jaw movement. Thirdly, talking about the interproximal spaces. Proximal surface is the mesial or distal surface of the teeth, and inter, it means we are in between two different teeth. So if you look from outside, from facially and lingually of the teeth, it is appreciated that we are narrower at the cervix mesiodistally than at the occlusal surface. This gives an arrangement that is a triangular or pyramidal in shape in between the adjacent or approximating teeth, just cervical to the contact area. The base of the triangle As you can see here, the base of the triangle is at the alveolar process between the adjacent teeth, while the sides of the triangle, red triangle here that you see, are formed by the proximal surfaces of the teeth. The apex is going at the contact area between the two teeth. These spaces in between the teeth are called interproximal spaces. They accommodate and they protect the gingival tissue in between the teeth, and it fills the space by the what's called the interdental papilla. A papilla is a projection of the gingival tissue that is located in between two adjacent teeth. When viewed from buccal side, you can see, on the proximal side, interproximally, the part of the interdental papilla that lies just below the contact area and extends from the facial-lingual direction. It is called a coll. A coll, it is a depression in between two mountains, for example, or two as you can see here, between two elevations, the depression is called a coll. It is called a gingival coll when you see the gingival tissue in a facial-lingual direction. What it helps, the tight contacts in between the teeth, the adjacent teeth, would help this protection of the skull tissue and the interproximal gingival tissue buccally and lingually. So if you see, the anterior teeth have a small coll, and the posterior teeth, which have higher surface area, have a large area of the coll as well as a larger contact areas in between the teeth. In addition, the roots of the teeth, they give a taper from the cervix to the apex of the tooth. It, it tapers in a conical shape, creating enough space between the roots of the adjacent teeth. This would allow for the alveolar bone filling the space and higher surface area so that the teeth are securely anchored in the jaw. This arrangement would give also a adequate space for the connective tissue, blood supply, nerves that support all, or let's say the supporting structures of the tooth. The form of the interproximal space will vary with the proximal contours of adjacent teeth and with their alignment. So, proper contact and alignment of the adjacent teeth is essential to provide enough space between them for a normal bulk of gingival tissue to be attached to bone and to the teeth. Fourthly, speaking about proximal contact areas after the full eruption of the tooth, when the tooth takes its final position in the dental arch and it becomes in contact with two adjacent teeth of the same arch, a distal and a mesial contacts. Although the contacts with age they become broader, and that we will talk about in the clinical manifestations due to proximal wear, but the term contact area is always preferred to a contact point. You can see, except for maxillary and mandibular central incisors, which have only a mesial contact point of a tooth facing the other mesial contact point of the other tooth, except for this set of teeth, all other teeth, the mesial contact area faces the distal contact area of the adjoining tooth, and the maxillary and mandibular central incisors are the only exceptions. As well as, of course, the last tooth in the dental arch, whether it's a second molar or a third molar, it does not have a distal contact area. So, adjacent teeth should have a tight contact with each other, and a proper contact relation between the different adjoining teeth is important for multiple reasons. Firstly, so that a contact relation would be established to have a full function as a single unit, as we said, so that the masticatory forces would be well distributed to ensure occlusal stability due to the combined anchorage of all the teeth. Also, proper contact would prevent food impaction and later on caries, decay, periodontal problems. Also, it would help to protect interproximal gingival tissue through the tight contacts between the teeth. So, in terms of the position of contact areas, they depend on the type and on the form of the crown of the teeth. So, it can be examined from two views, either from facially, which is labial and buccal views. When you say labial view of the tooth, it is relating to the lip. When you say buccal, it's relating to the buccinator or the cheeks. So this is the facial view of the tooth. Here we have the relative position of the contact areas are cervico-incisally or cervico-occlusally, if you look from here. While if you look from an incisal or occlusal view, you would see the contact areas in a labiolingual or buccolingual position. So, as viewed facially, let's talk generally in all the teeth. As the height of the crown decreases from when you go backwards from the central incisor to the last molar, the size of the crown, it would decrease. Accordingly, the contact areas between the teeth become more cervically positioned as you move away from the midline. Distal contact areas are more cervically placed than the mesial contact areas. We know that in all the teeth, the distal contact area is placed more cervically, except we have two exceptions which you might know about: the mandibular permanent central incisors, where we have both mesial and distal contact areas at the same level because they are bilaterally symmetrical. The other exception is the mandibular permanent first premolar, the mandibular 4, where the mesial contact area is more cervical than the distal contact area, and this is the only exception. Secondly, if you view the proximal contacts from occlusal macroscope, let's say, we would know that in anterior teeth, the contact areas are small and they are centered. They are from labiolingually, they are positioned in the center. While going to posterior teeth, you will see more broader contact areas, and they don't seem to be bisecting or in the center. Compared to, let's say, the anterior teeth, the posterior contact areas become more into the buccal, placed buccally than lingually. The fifth aspect to talk about are what is called the embrasures. When two adjacent teeth of the same dental arch they come in contact, we have curvatures adjacent to the contact areas, forming a V-shaped space, which is called embrasure or a spillway space. Why it's called a embrasure? As a V-shaped adjacent to the contact areas of the teeth, we have the narrowest part of the V at the contact area, whereas it would be wider facially to form a labial or a buccal embrasure, and lingually to form the lingual embrasure. And if you look occlusally, you would have an incisal or occlusal embrasure. This is an example of the, on the left, of the embrasures or spillway spaces of the first molar occlusal embrasures. And when you look from occlusally, the teeth number 4, 5, and 6, you would have the buccal embrasures and the lingual embrasures of the multicuspids. You can see the incisal or occlusal embrasures from the facial view, and B, you can see the buccal and the lingual embrasures as seen from occlusal view of the teeth. Now, what are the functions of these embrasures? This would give a spillway, as the name indicates, a spillway for the escape of food during mastication. They also reduce the forces on the teeth during hard material grinding. Also would prevent from the food from being forced inside the contact areas, for example in the incisors, and they will make a self-cleansing mechanism, as we have rounded and smooth surfaces of the crown. They are exposed to cleaning action of the foods and friction of the teeth and lips. Embrasures and contact areas, they would protect the gingiva from undue trauma. Lastly, speaking about the curvatures of the of the teeth, we have what's called the cervical line, which signifies the cement enamel junction or the epithelial attachment, the soft tissue attachment at the neck of the tooth. This cervical line, if you join it with adjoining teeth, the adjacent teeth, if you join the cervical lines, you would observe that on proximal surfaces of the adjacent teeth, it is nearly the same level, and in all teeth the extent of the curvature is greater mesially than distally, as you have noted while drawing. In general, also the curvature of cervical line on the distal surface is 1 millimeter less than that of the mesial surface of the tooth. For instance, if you remember the central incisor, the extent of the cervical line curvature on the mesial surface is 3.5 millimeter, while the distal surface it is 2.5 millimeter. Moving of the cervical line curvature, it would be maximum in the midline on the mesial surface of the central incisor, it is 3.5 millimeters, and it would decrease gradually, that would become flat, 0 millimeter at the molars area. Also, in both arches, the anterior teeth have greater curvature mesiodistally of the cemento-enamel junction than the posteriors. Another curvature we have is the occlusal, imaginary occlusal planes or curves. We have two curves, curve of Spee. So when you view from the buccal aspect, the cusp tips of the posterior teeth, they follow a gradual concave curve from anterior to posterior. So the curve of the maxillary arch is convex, and the curve of the mandibular arch is concave. The other curve is curve of Wilson, which is the side-to-side curve. When you see or view the anterior aspect of the mouth slightly open, the cusp tips of posterior teeth follow a gradual curve from the left side to the right side. The curve of the maxillary arch is convex, and of the mandibular arch is concave. So the lingual cusps of the posterior teeth, you see they are aligned at the lower level, while the buccal cusps of both sides and in both arches are at lower level. Have a look please at the left side, the curve of Spee, which indicates the anterior-posterior occlusal plane, and on the right side the curve of Wilson, which is the side-to-side curve at the molars area. Finally and lastly, you can have a look at the clinical considerations of the physiology lecture, talking about the physiological tooth movement, the until eruption of the teeth, the physiological mesial drifting, the over-eruption or occlusal eruption when losing an opposing tooth, and the mesial drifting when losing a neighboring tooth. Also, we can talk about clinical significance of the forces affecting on the teeth and the jaws, and you have a paragraph about tooth wear and how it affects the proximal contact areas between the teeth, making them more wider in area.